My name is Kari Rayl, CEO of TrueGenix and Personalized Lifestyle Nutrition, and I'm a functional diagnostic nutrition practitioner. Vibrant America is a vital piece of what I do daily as a functional medicine practitioner. It is vital that we test and not guess, and that's where Vibrant comes in for me. My goal is to get to the root of their symptoms, not treat symptoms. And so with the various level of labs, I'm able to identify the root cause and deal with the patient's symptoms from that level. There's many different examples I can give you of how Vibrant America has positively affected the outcome of my patients. Right now in Oklahoma, GLP-1s are just booming. And so I get a lot of them coming in, trying to figure out what's wrong with me. I've lost all this weight, but I have all these symptomologies from this program they've been on. And that's where micronutrient, I need to look in your cell. Second, your microbiome. I need to understand any dysbiotic material that could be interrupting your gut-brain information, that signaling. And then lastly, the neurotransmitter. If you're suffering from dopamine depletion, these 3 tests are required for me. There's a lot of labs out there that offer great prices, but their deviation of error is not up to my par value. And Vibrant America meets that for me. Every lab, urine, stool, saliva, serum, dry blood spot in one dashboard. And that way, from my front end to the back end, we're all organized, and that helps the patient feel a lot more comfortable. What I like most about working with Vibrant America is access and the standardization and organization. And when I say access, if I need assistance interpreting a lab, I'm able to get on a practitioner's schedule, go over all my patients' labs, and help better define what that protocol should be to make sure I am competent in what I'm delivering to the patient. Vibrant's reports usually give you more than one way to deliver a message. The micronutrient panel, for example, you can look at 3 different ways on that panel of how to interpret the data for a patient. What I find they like the most is the reference ranges that look almost like a cup, right? You can see, is your cup empty, halfway full, or completely full in comparison to what's freely floating in your blood, your extracellular nutrients. And that helps them put it together, so when they do go back for their wellness checks with their providers or their specialists, they're able to say, look, yes, vitamin D looks like it's 110 in my serum, but it's actually halfway full in the cell. One of the most positive things that I love working about Vibrant America is they're not an insurance-driven model. That insurance-driven model makes it where I cannot treat the patient. The insurance company treats the patient. Removing that complexity allows me to treat the patient as a whole and provide the services they need.